Should you pay a yearly fee for someone to advise you on your Medicare health plan options? Short answer is no. I'm going to explain why and why you should run away from people that are trying to charge you to simply give you advice. My name is Christian Brindle. I'm a Medicare health plan expert and specialist. I've been doing this almost 11 years now, and I own and operate the company Christian Brindle Insurance Services, also known as Everything Senior Insurance, and we specialize in Medicare health plans. Everything under the sun: Medicare supplements, Medicare Advantage plans, Medicare Part D prescription drug plans, and anything that could be tied to Medicare. There is such a thing out there in the Medicare world as called a Medicare consultant. You're seeing these people start to pop up more and more. And what a Medicare consultant is it's somebody that you can pay a fee to. Some of them charge you as much as $2,000 a year to do an annual review with you and make sure that your plan is the best one for you, but they're not enrolling you into anything. What they're doing simply is taking a look at your situation and going through your different options and making recommendations based on your specific situation, and then you take that information, you go off and you sign yourself up for said plan. Okay? Now, why is this a problem? Well, the short answer is because if you worked with a licensed insurance agent, you would get that exact thing for $0. Let me explain. What a licensed insurance agent does is a licensed insurance agent is able to look through your options, and because they are contracted with multiple different insurance companies, if you're working with someone that's known as independent, they can make a recommendation based on your needs and preferences, and then they are compensated by the insurance company to provide you not just your enrollment, but also service on your plan over the course of time. Okay? Now, the argument that these Medicare consultants make and their justification for charging you this fee is because they say the insurance agents are biased. The insurance agents are making recommendations that suit them based on the compensation and not what suits you as the client. A couple of things we want to tackle with that and, kind of expose some of those myths that are most of the time just not true. And there's three areas I want to tackle here. The first one is, if you're talking about Medicare Advantage plans, Medicare Advantage plans have compensation that's standardized by the federal government. Medicare each year determines what an insurance company can compensate an insurance agent as a servicing fee, and the insurance companies do not have any say in what that compensation is. It cannot go up, it cannot go down. It has to be set and standardized from all insurance companies. So with Medicare Advantage plans, regardless of which insurance company an insurance agent recommends, the compensation is exactly the same. However, it does stand true that if a certain product is recommended over another, that can vary in terms of compensation. What I've always said is what that comes down to is, do you trust your agent? Do you feel like your agent is a moral, ethical, and honest person? And typically, over a long period of time, their track record will show with their public perception and how their clients view them in terms of how honest and ethical they are. If you're working with somebody like us, for example, right, that's been in business over 10 years, you cannot find a negative thing online about our organization from a client that's ever worked with us. That's because we always take the client's needs into consideration. There are even some plans, and this is the second thing that a Medicare consultant would argue is the reason why you should pay them thousands of dollars a year, which is totally unnecessary. I mean, I think it's as unethical of a thing as I can possibly think of, charging thousands of dollars a year to poor seniors that are living off of Social Security oftentimes, that are living paycheck to paycheck for something that they could get for free. The other argument that they make is maybe the insurance agent doesn't represent every plan that you might have access to. And in some cases, that's true. There are certain insurance companies that don't work with insurance agents at all. However, most of the insurance agents I know, and internally, if we ever see a plan that is recommended for us for when we're looking at a case for a client that is their best option, if it's something we can't recommend, we will always tell them that. That just comes down to our integrity, because we care more about what's best for our client than anything else. And if working with us is not what's best for the client, we typically will make a recommendation that advises them not to work with us in certain cases. Now, that being said, there are only very, very few plans that we cannot represent. In fact, I would go as far as to say we can represent probably 95 to 99% of plans in most areas that we work with people in. So it's a very small segment of plans, and if it comes out that a plan that we can't represent is the best one for that person, we typically will make that recommendation. But Christian, not all insurance agents are like you. Not all agencies are probably like Christian Brindle Insurance Services, right? I would like to think that there's a very small percentage of individuals that make recommendations based on their own specific needs and goals. Of course, everybody that's in the insurance business wants to do well in their business and do good with their clients, but also grow their business at the same time. But that being said, I do believe that most people are honest and ethical people that I've ever met in the insurance space. Because of all this, I do believe there is no reason whatsoever to pay a Medicare consultant thousands of dollars a year when you could get the same service and the same quality of service, if not better service, I would argue, because you're dealing with somebody that not only is licensed, but they're certified. They go through all kinds of training through the different insurance companies. They probably typically are going to be more knowledgeable than anybody that doesn't go through that training each and every year. But more than anything else, let's say the service was equal. There is no reason to spend thousands of dollars a year for something that you can get for free. Please do not fall into this trap. It is definitely something that I've seen plenty of Medicare beneficiaries fall into, and oftentimes when I do talk to them, they feel like they were bamboozled out of their hard-earned retirement money. We don't want to see that happen to you. If you come across somebody that considers themselves and labels themselves a Medicare consultant and wants you to pay them money for advice, my advice to you would be to run the other way, because there is a plethora of great people in the insurance world that can help you for no charge, and they are good, ethical, honest people. I do believe in our organization we fit that criteria as well. I believe that we're honest, ethical, and we are always taking your needs into consideration first. Not only that, we're licensed in 45 states, so if you do want to talk to someone for no cost, for no obligation, if you don't want to write a check for $2,000 to get some advice on your insurance, call us today, 801-255-5340. Again, 801-255-5340, and we can help you at no cost, no obligation on your specific plan. Again, we're licensed in 45 states. We'd love to be a resource for you. And again, my advice, run the other way from these charlatans, these vultures. It's unbelievable that this thing even exists. It's unbelievable to me that I even have to make this video, but here we are. If you agree with me, I'd love to have some dialogue with you. What do you think about these Medicare consultants? Do you believe that it's ethical? Do you believe it's unethical? Leave your comments down in the comment section of this video. I'd love to have a dialogue with you about this. Also, make sure to like this video. Smash the like button, as a matter of fact, for the YouTube algorithm, so that way more people like you can find this video and won't fall into this trap of Medicare consultants and end up losing thousands of dollars of their hard-earned retirement money. Make sure to subscribe. We put out weekly videos to help you have the power to be able to be empowered to make sure that you're making the best Medicare choices and be able to spot what's right from wrong. Make sure to subscribe. We put out weekly videos. And until next time, everybody, hope you enjoyed this video. We'll see you on the next one. Happy Medicare, everybody.